I'm Dr. Doug Katsev, and this is the Medical News Minute. Chronic dry eye is one of the major causes that ophthalmologists work. We have a lot of patients that come in complaining of burning, itchy eyes, and we need to do something about it. We need to help these people out. They have a difficult problem that they're not getting relief from. Chronic dry eye syndrome is a very common thing in the United States. It affects over 30 million people. This issue is something that people come to their doctor all the time and say, my eyes are burning, they tear, they cause irritation. They can't get through their day without having this problem, and we need something to help them out. It's important to treat dry eye syndrome as a cataract surgeon because you need a good tear film in order to see well. We're going to take out their cataract and replace it with an intraocular lens in order to improve their vision. But if their tear film is not good from dry eyes, they won't see well. When you want to treat dry eye syndrome, you usually start with artificial tears. We have other medications besides artificial tears that we've had for some time. One of them is called Restasis. Restasis works well. It stops inflammation of the eye tissue and thus produces a less dry eye. The problem with Restasis is it takes a while to work, maybe as long as 3 months. Sometimes you don't have that much time for a patient to wait around for the medication to really start taking effect. The complications of using Restasis are very little. The biggest complication is the patient doesn't like the medication because it may sting or burn when they put it in. The other issue is just how long that medication takes to actually start doing something to the eye. The newest medication to treat dry eye syndrome is called Xiidra. It is a medication that also treats the inflammation around the eye. This medication can work a little quicker, and the studies show from anywhere from 2 to 12 weeks improvement of their dry eye. Are there any complications of using Xiidra? Really not any significant ones. The patient may have a little taste in the back of their throat when they use this medication, and so it's important that we let them know that. Occasionally people will say they have a little blurred vision with using the medication. But for the most part, it's the symptoms improving that really make the patients like this medication. There was not any head-to-head studies between Xiidra and Restasis, nor was there Xiidra and Restasis used together. They treat inflammation differently, so in the future we may find that there is a benefit to using both Xiidra and Restasis, but presently the studies are not there. The FDA approval for Xiidra was both for symptoms and for signs. The physicians that examined these patients saw that their eyes improved. That would be the signs. But more importantly, and probably more prominent, was the patients noted their symptoms improved dramatically on Xiidra from anywhere from 2 to 12 weeks. The burning and the irritation went away, and that is something that's very important as a physician that I want to happen. What do I usually use for chronic dry eye syndrome? The first drug is just artificial tears. When that doesn't work, my second line therapy is Xiidra, and the reason I choose that drug is because the onset of action is quicker. It still may take 2 to 12 weeks, but that's a lot quicker than when the Restasis that I've used in the past and still use as a third line takes anywhere from 3 months and even longer to take effect. They have a little bit different way that they attack the T cells with the cyclosporin, which is Restasis, and that somehow takes a little longer to take effect. It can burn a little bit more. This burning can be overcome with the use of Lotemax gel, which is a steroid, but you do not like to use steroids for long term. I think most physicians are still learning about Xiidra. It's a new medication and they have to get comfortable with it. I think the people that have used Xiidra are tending to use it more second line and then Restasis third line. I'm Dr. Doug Katsev, and this is the Medical News Minute.